Hello guys, welcome to my channel. Mohammed here. Have you ever wondered why hygiene is so crucial in healthcare? Let's delve into this. Hygiene, in essence, is the practice of maintaining cleanliness to prevent disease. In the realm of healthcare, hygiene takes center stage. Here's why. First off, hygiene acts as our primary shield against a host of health issues. When we talk about hospitals or clinics, these places are often frequented by people who are unwell, making them potential hotspots for the spread of infections. Hence, maintaining impeccable hygiene becomes an absolute necessity. Moreover, healthcare professionals are in constant touch with patients, their bodily fluids, and medical equipment. This interaction could be a breeding ground for germs if not managed with strict hygiene practices. Imagine a world where health centers disregard hygiene. Without hygiene, the healthcare system would be playing a dangerous game of roulette with our health. Hygiene in healthcare isn't just about cleanliness. It's a complex system designed to protect patients and healthcare providers alike. So let's delve deeper into this topic, shall we? Firstly, let's talk about hand hygiene. It's not just about washing your hands after visiting the restroom. In healthcare, it is an essential practice that healthcare providers must follow before and after every patient interaction. This simple act can significantly reduce the transmission of harmful bacteria and viruses. Secondly, we have the sterilization of medical tools. These instruments come into direct contact with patients' bodies, and hence, it's crucial that they are thoroughly cleaned and sterilized to eliminate any potential sources of infection. This process involves several steps, from pre-cleaning, disinfection to sterilization, each meticulously designed to ensure patient safety. Moving on, let's talk about the different types of hygiene practices in healthcare. To start, personal hygiene of healthcare providers is crucial. This includes basic practices such as bathing regularly, wearing clean uniforms, and maintaining good oral hygiene. These practices prevent the spread of germs and ensure that healthcare providers present themselves professionally. Next is environmental hygiene. This refers to the cleanliness of healthcare facilities. Regular cleaning and disinfection of surfaces, proper waste disposal, and maintaining good air quality are all part of environmental hygiene. A clean healthcare environment reduces the risk of healthcare-associated infections and provides a more comfortable space for patients and staff. Lastly, we have professional hygiene practices. These are specific to healthcare settings and include practices such as using personal protective equipment, following infection control protocols, and practicing safe injection techniques. These practices are designed to protect both the healthcare provider and the patient from potential infections. In essence, hygiene in healthcare is more than just keeping things clean. It's a multifaceted approach that involves several layers of practices, each equally important in ensuring the safety and well-being of everyone in a healthcare setting. Hygiene in healthcare is about creating a safe and healthy environment for everyone involved. And remember, each one of us has a role to play in maintaining this hygiene, whether you're a healthcare provider or a patient. Hand hygiene. It's a simple action, yet it plays a significant role in healthcare. From doctors to nurses, from patients to visitors, everyone shares in this responsibility. But why is hand hygiene considered the pinnacle of hygiene practices in healthcare? Well, it's because our hands are the primary mode of transmitting infections. We are using them a lot. These are specific instances where healthcare providers should ensure their hands are clean. The first moment is before touching a patient. This is to protect the patient against harmful germs carried on the provider's hands. The second moment is before performing a clean or aseptic procedure. This is to protect the patient against harmful germs, including the patient's own, from entering his or her body. The third moment is after being at risk of exposure to body fluids. This protects the healthcare worker and the healthcare environment from harmful patient germs. The fourth moment is after touching a patient, and the fifth is after touching patient surroundings. These last two moments protect the healthcare worker and the healthcare environment from harmful patient germs, even after only touching the patient and their immediate surroundings. These 5 moments have revolutionized hand hygiene practices in healthcare settings, emphasizing the significance of clean hands at every step of patient care. They've become a global standard, reminding us that hand hygiene is not just about cleaning your hands. Hand hygiene, therefore, is not just crucial for healthcare professionals, but also for patients and visitors. It's a collective effort where everyone plays a part. It's about creating a safer healthcare environment, one hand wash at a time. So, whether you're in healthcare or just visiting someone who is, remember the importance of clean hands. Because when it comes down to it, clean hands save lives. It's as simple as that. A clean environment is a safe environment, especially in healthcare. Now, let's delve into environmental hygiene, a crucial aspect of healthcare that is often overlooked. When we talk about environmental hygiene in healthcare, we're referring to more than just a spotless floor or dust-free corners. It's a comprehensive approach that involves an array of practices, all designed to ensure that the healthcare environment does not contribute to the spread of infections. One of these practices is proper waste disposal. In healthcare settings, waste can range from used tissues to discarded surgical instruments. Each type of waste requires a specific method of disposal to ensure that it doesn't become a breeding ground for harmful microorganisms. For example, biohazardous waste must be disposed of in specially marked containers and then incinerated to eliminate any potential pathogens. Another key aspect is the sterilization of medical equipment. This goes beyond the usual cleaning. Sterilization involves the use of heat, chemicals, or radiation to kill all microorganisms on a surface or instrument. This is critical because even a single surviving microbe can lead to an infection. And then there's the importance of maintaining clean surfaces. This isn't limited to the obvious places like floors or countertops. It includes everything from door handles to computer keyboards, anything that people touch regularly. Regular cleaning and disinfection of these high-touch surfaces are essential to prevent the spread of pathogens. But why is all this important? Well, environmental hygiene is a key player in infection prevention. Remember, a hospital or clinic is a place where people come to get better, not to acquire new illnesses. And maintaining a clean environment plays a pivotal role in ensuring that. A clean environment in healthcare helps prevent the spread of diseases and protect public health. And as we move forward, let's continue to prioritize and advocate for environmental hygiene in healthcare settings. It's the first line of defense in protecting our health and the health of those around us. Healthcare professionals have a big responsibility when it comes to maintaining hygiene. From the moment they step into a healthcare setting, these individuals are part of healthcare, so cleanliness care that is crucial in preventing the spread of infections. Let's delve into the core professional hygiene practices that every healthcare worker must adhere to. Firstly, personal protective equipment, or PPE, is more than just a buzzword. It's a vital part of a healthcare worker's uniform. This includes gloves, gowns, masks, and eye protection. Each piece of equipment serves a unique purpose. Gloves shield the hands, gowns protect the body, masks guard the respiratory system, and eye protection shields the eyes. It's not just about wearing them, but also knowing when and how to remove them safely to prevent contamination. Then, we have cleaning protocols. Surfaces are not just wiped, they're disinfected with hospital-grade solutions. Similarly, linens are not just washed, they're sterilized. Every nook and cranny, from waiting rooms to operating theaters, is held to the highest standard of cleanliness. Next is the safe handling of medical equipment. This is a broad category, from stethoscopes to surgical instruments and everything in between. Each piece of equipment has specific cleaning and storage instructions that must be adhered to. For example, some instruments need to be sterilized after each use, while others require special storage conditions to prevent the growth of bacteria. Lastly, let's not forget about personal hygiene. Healthcare workers themselves need to be models of cleanliness. Regular hand washing, maintaining short nails, avoiding jewelry, and wearing clean uniforms are just a few examples of how personal hygiene is maintained. Healthcare professionals are the guardians of hygiene standards in the medical field. Their commitment to these professional hygiene practices plays a significant role in ensuring the health and safety of every patient they interact with. They are the unseen heroes, tirelessly working behind the scenes to keep us safe. So we've explored the vast world of hygiene in healthcare today. Let's take a moment to recap what we've learned. We started with the importance of hygiene in healthcare, understanding how it plays a pivotal role in preventing infections, promoting health, and saving lives. We then delved deeper into hand hygiene, a simple yet powerful tool in combating disease transmission. Exploring environmental hygiene, we discussed how maintaining a sterile environment from patient rooms to operating theaters is crucial for patient safety. Last but not least, we touched on professional hygiene practices. These practices, followed by healthcare workers, from washing and sanitizing hands to correctly disposing of waste, ensure that healthcare facilities remain a safe space for everyone. By the way, personally using a disinfectant will help you a lot. Next time you visit a healthcare facility, remember the importance of hygiene and why it's taken so seriously.